Hi.
Hi, everyone. Welcome back to our talk show.
Happy Friday. No mimosas this Friday. Maybe the next one.
We have to work on
We
that.
we hope you guys had a great Thanksgiving. And I know the holiday season is coming up, so it's busy and hectic for everybody, but we still have to talk about your health.
And we
So,
want to thank you for tuning in today.
and thank everybody for like sending all the requests for options and different subject matters to talk about, and also everybody who actually sent in names for us to name our show. And we're gonna reveal it.
So make sure you watch the end, and we have a special prize for you. And make sure you go on and you like our page, our social media, and make sure you stay and you ask as many questions as you want.
So we're just gonna first start off by doing some cleanup. Dr. Clark-White's gonna tell you her event that's going on.
Yes, I'm very excited. I'm having it's called Botox and Bubbles event on Saturday, the 11th from 6 to 9 at my office, 1935 South Wabash. That's in the South Loop. So come. She just posted it for you guys to see. Come have a drink, appetizers. We're going to play games. We're going to have fun. It's going to be a lot of fun. So come out. If you've never tried Botox, you can try it here. If you don't want to try it, just come out and have fun with us and have a drink with us.
Okay, I'll be there. so, so, um, and then just updates for us. We're actually doing our 12 holiday Christmas deal. So just about everything is 20% off. So this is if you were thinking about getting something, if you want gift certificates or gift cards for people, you don't have to do the procedure or whatever now, but it's only from January 1st. I'm sorry, December 1st
And she
through
hasn't
December
even had a
16th.
mimosa.
I have not. It's been busy. So up until December 16th, get your 20% off. Call, do it over the phone, come in. We love to see you.
She has some really good deals. She doesn't know it, but I'm going to take advantage.
We don't do this often. Okay, so I can never remember this. So like us, follow us, and subscribe to our social media pages, and we'll have those posted. Share this video if you think someone can benefit from the topic that we're going to discuss.
You can always send in questions afterwards. We will definitely answer those questions. And make sure you remember we're doing this every first Friday, 2 o'clock, but we're thinking about changing the time.
We're thinking about changing the time to later, just so everybody can be off work, and then we can include our mimosas. Can conclude our mimosas during the workday.
Also, we want to have some guests on the show, and that time might be best for them as well. So,
and we'll have lots of topics, all of it dealing with your health and different concerns. So continue to send in those questions, subjects.
suggestions.
Yes. So all of those things.
So today was suggested by a few of our viewers, correct? And we're actually, it was suggested by one, and I guess we're going to announce that person as well. She gets a gift as well. But it was actually contraception after 50. So since you wanted to know about that, we thought it would be good to just talk about birth control from your teenager up into perimenopausal. Now, after 50, what do you think?
So I have delivered 49-year-olds. I'm just saying, if
My
you still,
oldest was 47.
I, so most of
Spontaneous?
us are not Janet Jackson. Yes.
Yeah, you're right. You're right.
And we don't have nannies. And so 50, you're a little tired. so I don't know. I'm not saying there's anything wrong with it. If that's what you want to do, we will help you do that. If you don't want to do that, then and you still have a period,
Maybe
listen to this podcast.
theoretically, if you're still having a period, you're probably still ovulating. You're right, I guess. I just haven't done a 47 has been my oldest.
Okay.
She was a little surprised too.
And I have had 47 and 48-year-olds who have actually come in wanting to conceive.
Mm-hmm.
So whichever way you want to go, great. We will help you in whatever venture you want to go. But if you don't want to have
then maybe you should.
So just continue to listen to these options, and there's lots of different options. I'm sorry, you guys. I gotta turn my stuff off.
So today we're going, while she's doing that, we're going to start by talking about the contraception. And there's so many different types. So you don't have to say, oh, they don't work for me just because you tried one and you didn't like it. You felt like it didn't work for you. We have, of course, birth control pills. And there's so many different combinations if you
It's a
prefer a
lot.
pill.
And most people now, I don't, so there's so many lower dose pills that people have less side effects for people who are perimenopausal that don't need that full amount of birth control, but just preventing you from getting pregnant and even having some of the hot flashes and some of the symptoms. There are birth control pills for that. We're going to post a list of like all the different options, but I kind of usually break it down into like hormonal versus non-hormonal.
Same.
Because that's usually how people deal with it. So we can start talking about some of the non-hormonal already.
So then in addition to hormonal versus non-hormonal, you have which ones are what's called LARC, so long-acting reversible, whether or not you want to continue to take a pill or you want to do something where you don't have to worry about it. And if you say non-hormonal for that, there's something called the Paragard or the IUD or the copper IUD, and it lasts for 10 years.
One thing I tell people, because I've had people come in with the Paragard, it's great. There are some people who will have heavier periods, and you may have more cramping during the time that you have the Paragard in. It can be fixed. Usually I tell people when I give them Paragard, I just automatically give them a prescription of ibuprofen, and that will help decrease the heavy bleeding, but it also will help with the cramping. Some of the other ones that there's a new one that yes, you've seen it on the commercial. She talks about all the things she's going to be doing and how she wants to use this. This is a gel. And so it is a spermicide, but it is hormone free, and you use it
when you're going to have sex.
Yeah.
But you have to, I think it's within an hour. If you don't have sex within an hour of placing it, you have to use a backup or reapply a different one.
I've also prescribed, well, it's not a prescription, it's actually over the counter. It's called the NuvaRing. And the NuvaRing, not the NuvaRing, it's Friday, it's been a long week. It's the vaginal film. So there's also the spermicide. The film, I think a lot of my patients like because it's not messy. So it looks like the breath strips you put on your tongue that melt, but it's a little bigger. And that you can get from like Walgreens, CVS. They will have those, last for 3 hours, have to reapply after 3 hours if you've got a long night. For them. So most people don't know about it, but it's something that they can get over the counter. And I've had a lot of people use them, but it's a spermicide, just like the other ones. Condoms. Whether you're not, you're trying to prevent birth control for my younger patients.
STDs, sexually transmitted diseases. That's the only thing that's going to work. Of course, if you don't have sex. Right. But if you're having sex, it doesn't matter what birth control you use. You have to use condoms. I cannot stress that enough to my younger patients.
And my older patients, depending on where you are in life. But I tell all of my college students, chlamydia and gonorrhea is rampant on college campuses. Use a condom.
We're actually seeing an increase of syphilis over the last 5 or 10 years. So use condoms.
Please use condoms. But it also helps with birth control as well. So we've covered condoms, we've covered spermicides, the ring, the Phexxi, we did Paragard. What else non-hormonal? I think
that's it.
Yeah. And abstinence. But that's now the flip side, hormonal. So many different options depending on age, depending on your symptoms. We can also use hormonal birth control to treat medical conditions. So So we're going to kind of run down a lot of the hormonal birth control. I guess we should probably start with the younger people first and work our way up what most people use.
My younger patients, I actually use the Nexplanon a lot.
Mm-hmm.
To use the Nexplanon.
So I recommend the Nexplanon. But
for my younger patients, I like that, or the IUD if they prefer it. Some of them prefer the IUD, but I like something just to be on board where they do not have to remember to take a pill every day. They don't have to remember to place a NuvaRing. They don't have to remember to change their patch, and it's just there. And that was good for me as well, because if I had to remember to take a pill, I would have had 10 kids instead of one. So,
well, I took my pill.
I did not. I set myself an alarm and still forgot. So.
This is an example of the hormonal birth control. So this is not the actual birth control. This is just to show people about the IUD. This is something that is actually inserted by a physician, and we insert it into the uterus.
It takes, sorry to cut you off, but it takes 2 minutes for us to place. You can come have it placed, go straight to work.
Ideally, I usually tell my patients to come in around their cycle.
Mm-hmm,
it's just easier to actually insert it. I always have them take pain medication 30 minutes before because it's crampy.
I do.
There's probably about 3 different types of hormonal IUDs, right? 3.
Probably more.
Maybe more now.
The Mirena, Skyla, Kylena. There's one more. Oh, I think there's one more.
You might be right. I don't know.
Yeah, it's always something new. They last anywhere. Skyla lasts for 3 years.
Mm-hmm. And it's a smaller version of this. So a lot of the teenagers will actually do this.
The applicator is smaller. Yes. So if they've never had a child, it's easier to get through the cervix. Although I've done the Mirena on them as well.
Most of mine do the Mirena.
Especially if it's on your cycle.
Yeah.
If you're on your cycle, like she said, it's easier to place. And then any contraception you start on your cycle, you have protection right away as well. So, and then I know, especially for my younger patients, they're not pregnant. I still do a pregnancy test.
I would do. So this lasts for 7 years now. It used to be 5, but the Skyla is 3, the Mirena, the Kylena, those 6. Are 6. This is 7 now.
Yeah, that's 7.
So the Kylena may be 6. But they're long term. If you are ready to have a baby, you just come in
and take it out.
And we take it out.
And if you're actively trying to get pregnant, over 90% gets pregnant within that first month. So you don't have to worry, oh, I've had this in for so long. Is it going to take long to get pregnant? No, you're going to get pregnant if you're trying to get pregnant.
So those are the IUDs. There are the NuvaRing. She mentioned that. Can you guys bring me a NuvaRing? I'll show you what an example looks like. But it's very easy to put in. It's flexible. You change it once a month. The IUDs, side effects. So the biggest thing that I would say most people complain about is the irregular bleeding in the beginning. But I always warn them that
I warn as well.
They may have some irregular bleeding. For
and
most
if
people,
they stick with it, it's probably going to stop.
Yeah.
When I had my Mirena IUD, a box of tampons lasted me a year because I rarely bled. And when I did, it was just spotting. I could probably get away with a panty liner, but I preferred tampons. So if you can just stick with it, it's going to resolve. Usually I tell them it's possible for up to 6 months.
Yeah.
But not everyone has it, and not everyone has it for 6 months.
And I would say you all know a lot of our business. But I would say when I had my IUD, and we're busy. So, taking something every day, putting in something, it just doesn't work. And it doesn't work for And it's actually good for teenagers as well. It's long term. They forget. And it covers them for that whole college period. So that's the biggest thing is the irregular bleeding, but it does go away.
And with the Mirena, the fact that it stops the bleeding, actually, it's been approved for us to use for someone who has heavy bleeding.
Mhm.
So I've used it for someone if they're beyond reproductive years and they're having heavy periods, irregular bleeding. I've used the Mirena for that. You can also use it for something called endometrial hyperplasia, which is a precancer state of the uterus. It's been approved for that as well. So there are other things we can use it for.
And it also helps with severe cramping. So people who, especially younger patients who have really, really bad PMS
Mhm.
and the cramping and missing school, that's something that can be inserted and that will help. The NuvaRing. so that's another one that is hormonal. And a lot of my patients don't like to have periods.
A lot of my patients. So I'll tell them instead of having that week off, so you place it, you leave it in for 3 weeks, then you take it out for a week. That during that week is when you're supposed to have your period. So if you don't want a period, instead of leaving it out, just place the other one.
So I have them leave it in for the full 4 weeks.
Okay.
And then I have them take it out because there's 24 active
Mhm.
days in the
Mhm.
ring. So I leave it in for 4 weeks, take it out, and put another one in immediately.
I usually have them leave it in for 3 and just place the other one.
Hmm?
Yeah, instead of having that week free.
Yeah.
So I haven't tried that.
Yeah.
I'll try it.
Sometimes the pharmacies are funny
About
giving
and
them.
I have to call.
So,
You're right.
and that's why I have them leave it in for the full 4 weeks.
Mhm.
But that's another option. So that's something that you insert vaginally. So if you're someone who is used to doing tampons and you're comfortable doing that, then that's a good option for you because you only have to do that once a month.
And it's very easy to place.
Yes.
It goes where it's supposed to go once you place it. You don't have to worry about, am I going to place it right? It's going to be placed right, just like a tampon is once you place it.
And they even have an app to remind you
Mhm.
when to
Mhm.
actually put your next one in. There's lots of things that they have to make sure that you are taking your birth control on a regular and timely basis.
A lot of my patients complain, not a lot. Some of them, they don't like the NuvaRing. They say it increases their discharge.
Mhm.
In the beginning, it can because it's something foreign to the vagina. So the vagina has to get used to it. So you might have a little increase in discharge, but it's your normal discharge. Just like the irregular bleeding with the IUD, you'll probably get used to it if you just continue.
Mhm.
But I have some patients, they don't like it. So
I have some too. And then there's the patch. So there is a weight restriction with the patch.
It is, and it's real.
When it says over 190,
190.
if you're over 190 and you're doing the patch, the efficacy, so how well it works, decreases. So I don't really encourage if someone's like close to 180, 185, I actually don't recommend it unless unless you're taking it for something medical and you're not as worried about birth control. But the birth control effect is not as great if you are over 180. But it's easy.
It is easy.
You put it on. There's only certain places that you can place the patch. I had a patient who got pregnant. She had the patch on her ankle. It does not work. Yes, it doesn't work down there. So usually you place it on the abdomen, on the shoulder. You can put it on the butt. I like to have my patients change the location
of the skin irritation that they complain of,
and that you change weekly. Sometimes it can leave like a demarcation of where the patch actually was. And I just have them take hydrocortisone and that will actually resolve. It'll resolve the discoloration. So that's the patch. There is a slight increased risk for blood clots with the patch. It's slight. Any birth control that has hormone does increase the risk of developing like what's called deep venous thrombosis or DVT, which is a blood clot in the legs.
And it's usually the estrogen. Now, they're both hormones, but it's more from the estrogen component and the type of estrogen, which is why if I have someone that have risk factors for it, 35 and older, smoker, I would prefer to use something without hormones. But if they want something, I use the IUD. The IUD works locally and it's just progesterone. There's no estrogen and it's more of a local effect. So you don't get those same systemic side effects.
So let's separate the ones that have progesterone only and then the ones that have both. So the IUDs that we showed you, those are progesterone only.
All the IUDs except for Paragard. There are no hormones.
Right. The
Nexplanon.
The Nexplanon, which is that it's an insert that actually goes in the arm, and it's good for 3 years. That's
it's
progesterone.
Good for 3. You can actually use it for 5.
Okay.
It's FDA approved for 3, just like the Mirena IUD. At one time, it was FDA approved for 5, but actually works for 7, and now they changed it to 7. But you can actually use the Nexplanon for 5 years.
So there's pills. There are pills that you only have progesterone and there's no estrogen in them. And those are people who, like Dr. Clark-White said, if you're a smoker, if you're over 35, ideally, I don't like smokers being on birth control, not hormonal. So we try to get you off of the tobacco. So those are things that I would probably suggest. So we've talked about the IUDs, the Nexplanon, the pills, and then there's the shot. It's pretty common with teenagers. I think a lot of them prefer it. What I do tell people is that if you're getting the injection, I always put all of my patients who are doing depo on, I make sure they're taking vitamin D.
I do too.
Because it can thin the bones is temporarily. So it's reversible once you stop it.
Yeah.
But I always make sure that they are taking vitamin D. The other thing with the shot is that the bleeding can be very irregular.
So you can have no bleeding for months, and then you're on the beach on vacation, and all of a sudden. So you have to be careful with that, or you have to expect that can happen. With the thinning of the bones, it's more likely to happen if you take it longer than 2 years. But like she said, it doesn't matter. As soon as you start taking it or start having it, you should start taking the vitamin D at that time.
I also have people, and one of the things that probably the Depo has a little bit more regular bleeding than the rest of them. But people really like it. It can sometimes change your appetite. So people always ask, am I going to gain a lot of weight with birth control? So you still have to watch, even if it changes your appetite, I still tell people to watch what you are eating. You can't eat Snickers and cookies and candy bars and not expect to gain weight. You will gain weight.
Especially if you're not active. You will gain weight. Even if you're not on the birth control. So, and now you're on these hormones, so you're definitely going to gain weight.
I've seen people gain a significant amount of weight.
Same.
So you have to be very, very aware of what you are actually eating, what your diet is like. But it works great. I would probably say they come in, get their shot, and leave, and it's good for 3 months. So 12 to 14 weeks is when we have you come in, and you get it every 3 months for the Depo.
With the Nexplanon, we didn't really, she said it's a small rod shape. Do you have a sample here?
No.
I have one in my office. I forgot it. But it's small, it's rod, it's flexible. It inserts right underneath the skin, right on top of this muscle here. It takes us like a minute to place. We don't have to cut you. The applicator is a sharp tip, and we just kind of shoot it under there after numbing you up. Again, it takes as long as probably the Depo, just a little bit. It's very quick.
It's pretty quick. And nobody knows you have it unless you put your arm up and say, feel this.
Because you can feel it, and we want you to be able to feel it. Yeah.
So those are the progesterone only. The rest of them are going to have estrogen in them as well. So we've talked about the NuvaRing. We've talked about the patch. Of course, the pills.
Anything else? Let's look at our cheat sheet.
I think that's all of them.
With the progesterone only pill, I don't use that a lot. You have to be very careful with that pill. So with the pills, if you miss a day, the next day you take 2. If you miss 2 days in a row, the next day you take 2. The following day you take 2. The third day you're back on track. If you miss 3 days in a row, you have to stop that pack, wait for a period, and start another one. With the progesterone only pill, if you do that a lot and you have sex during that time, you're more likely to get pregnant. So you have to make sure with that one, you have to be motivated to take it around the same time. I will have my patients take it who are breastfeeding in that very beginning after delivery. But I tell them they probably shouldn't be having sex, but and if they are, I tell them they have to be careful because you're more likely to get pregnant if you do miss a pill.
So we didn't talk about the female condom. There is a female condom. So it's not just one for males, but there is a female condom that females can use as well. You can buy those over the counter. There are diaphragms. People still use diaphragms. And that's something that usually you get fitted for in the office, but there's a diaphragm, so you use a spermicide with it and you insert it into the vagina.
When is the last time you did a fitting?
It's been a long time.
I've never done it.
But I have a couple people who still use diaphragms. Not as common. And then the ultimate birth control is a tubal ligation or a vasectomy. That is also a birth control. It can't be up to just women to take care of the birth control.
It seems like today more men are willing to do it.
They are. It's done for men. That procedure is done most of the time in the office, and they may be a little sore. You may have to baby them a little bit, and that's okay. But they are back up doing their routine. But it is something that, and these are meant to be non-reversible.
Yeah.
If you think that you may want another child, I would not do something that's permanent. These are meant to be permanent birth control.
So you have to tell us that you're 100%. You can't say, well,
no, they have to be 110%.
Yes. Because actually now we don't really do that many tubal ligations.
Right.
It's actually recommended for us to remove the tubes. And the reason is because a lot of or some ovarian cancers start in the tube. So if you're not planning to get pregnant, you don't need your tube. The tube is just a gateway from the ovary to the uterus for pregnancy. So you don't need it. And so why not just remove it and you can decrease that risk of ovarian cancer. So definitely that's not reversible.
No. I tell, because I've had 20-year-olds ask me to do something permanent. Because I've seen 20-year-olds come in and ask for it and someone else did it.
Yeah.
And I've had them come back when they're 30.
And they want it.
Because their partner doesn't have kids. And now you're thinking, well, what do I do now? Make sure you do not. I know you feel that way now. I don't even ask people right after if they want to have a tubal ligation, because sometimes giving birth can be a little traumatic. So we give you some time to think that through. But you have to be 110% sure you do not want to have any more kids, because it is not meant to be reversed.
Yes.
But I think that's
it. Unless we talk about withdrawal, but I don't even include that.
That is not a birth control.
It is not. You have been very lucky.
Believe it or not, I mean, recording your ovulation is more effective than the withdrawal method. So there are some people who do the rhythm method. And so what they do is they record when they're ovulating. If you are having a regular cycle, most people will ovulate halfway in between that cycle. So if you started your period today and you have a 28-day cycle, well, 14 days from now, you're going to be ovulating.
You usually have your peak ovulation.
Right. well, the other thing is that sperm also can live for 3 days.
For 3 days.
So it's swimming around there.
Chance.
So I tell people around about almost that week of when you're before, maybe a couple days before and a couple days after that peak. If you are using the rhythm method, that's when you need to avoid having intercourse.
Yes.
But the withdrawal method, semen can actually leak out before they actually have an ejaculation. Yep. So no rhythm, no withdrawal method. That's not a good choice.
And there are too many other choices. We can find something for you. You don't have to say birth control in general does not work for me. We have too many choices for that.
So hopefully that has helped. We've started with teenagers all the way to perimenopausal. You know, if you are over 40s and you're looking to have a baby, we can address that as well in a different segment, and I think we should probably have like some infertility specialists
I think that's a really
that
good
maybe
idea.
come
I
on
know
for
someone.
people who may
Yeah.
be, concerned about it, or what do I do next, and we can give you those answers. Well, they can give you those answers.
But
Okay,
thank you for tuning in.
wait, we have to announce
Oh, that's
our
right.
new name. Okay, so we have these coats on. Oh, thank you, Beanish. How are you? I heard you won that gift from, I won't say what it was from, but congratulations with that. So we'll see you soon to get that done. Okay.
I think she's giving us some.
Oh, okay. So you're seeing that we're going to reveal the new name. Let's talk about how we even have T-shirts made. So thank your
medical assistant.
Yeah. Thank you for the T-shirt.
Thank you, Lahoma.
So this is what our new topic will be.
Oh, Tamika. We went to high school with her.
That is the winner for the new name.
Let's talk about health.
We're excited about it. So it really is about not just we can take our jackets off, not just our health, but men's health, your kids. We're not pediatricians, so we don't know a lot about we know some, but
we can always invite someone on.
We can invite pediatricians on to have
we want it to be for everyone.
Yes. And we want you to know about your health. Okay.
Oh, so just remember a few things we want to make mention again. Remember the event I'm having at my office, 1935 South Wabash. And Bubbles.
Bubbly. She has not had bubbly, but that's what her name.
Please come out. I promise you will have lots of fun. We're going to play games. We're going to do a lot of educating, and it's just going to be a lot of fun. I'm calling it Girls Night Out.
And then for us, over at Allure Laser and Med Spa, we are doing the 12 days of Christmas. So those specials are running December 1st through the 16th. It is 20% off just about everything. Not everything, but just about everything. We are doing 20% off. So after you've had your Botox at Dr. White's office, come on over. Because Botox is actually not one of the things that we're actually doing a special
Okay,
on.
so come to Ladies Girls Night Out.
But we want to thank you guys for joining.
Thank you.
Let's talk about health.
Next month.
So we will see you next year.
Oh wow.
So so have a great and wonderful holiday season.
Merry Christmas.
Happy Hanukkah.
Happy holidays.
Happy holidays. And we will see you January the
first Friday.
January the 7th at 2 p.m. First Fridays of the month.
Thank you.
See you guys later.
Enjoy.
Bye.
Taking a chance.